The presentation today is on the role of exercise in multiple system atrophy. So from a 2018 review paper on therapeutic management of atypical Parkinsonism, the authors stated that exercise, occupational, physical, and speech therapy and psychotherapy should always accompany pharmacological approaches. So you can see that here exercise is emphasized as one of many treatment options to assist with patients with neurodegenerative conditions such as multiple system atrophy. Before I continue with the presentation, there's a couple of definitions that I'd like to just run over. First one, what is exercise? Now, exercise has to do with a specific type of physical activity that is planned, it's structured, and it's repeatedly done to improve or to maintain physical fitness. Now, this is different to physical activity. And sometimes people can basically think that exercise and physical activity are synonymous when they're not. So physical activity is related to any bodily movement that produced by the skeletal muscles that results in energy expenditure. So if we're going for a walk around the block and that walk around the block is not planned, it's just basically an activity that you want to just engage in with your family, and it's a nice day outside, well, that would be considered as a physical activity, as opposed to if you deliberately wanted to start to lose weight and you would go down to the park and you have in the back of your mind a certain type of session that you're going to be engaged in. That would be exercise. So that's the difference between exercise and physical activity. Now, the big thing about exercise is it is focused. It's focused towards improving or maintaining physical fitness. So what is physical fitness? It's the ability to execute daily activities with optimal performance, endurance, and strength with the management of disease, fatigue, and stress, as well as reducing sedentary behavior. So essentially, improvement in fitness should be the goal for an exercise program in patients with neuromuscular disorders such as MSA. Now, in terms of exercise in patients with neuromuscular disorders, exercise is considered a medicine, and that's due to its positive effects on the treatment as well as prevention of a variety of chronic conditions. So those chronic conditions can include heart disease, diabetes, and the list goes on. Regular exercise requires a greater effort than just taking a drug. So in terms of like treating exercise as medicine, we know that compliance can be an issue with taking medicine, but it can also require a greater effort when it comes to doing exercise. So that's something that is a bit of a challenge and something that should be considered when trying to make exercise a focal point of someone's treatment or management. 50% of health status is attributed to unhealthy behaviors, and physical activity is actually one of the main contributing factors there. So if we can get people more active, that's a great thing. That's a great thing in terms of trying to improve their overall health and reducing the risk of developing complex conditions. Or if they already have a condition such as MSA, reducing the risk of developing other types of diseases and conditions. Now, a long time ago, probably 20 years or so, clinicians were quite reluctant to prescribe exercise for patients with neurological or neuromuscular disorders. And that was due to concerns about damage of the muscles with overuse. Now, that concern now has been debunked in terms of that myth of exercise leading towards, I guess, a detrimental effect. There are numerous studies that have shown that exercise in its essence is not considered to be detrimental for people with these kinds of conditions. Now, there is some things that should be considered when it comes to planning exercise, and I will talk about those at the end or towards the end of the presentation today. But it should be just kept in mind that overall exercise is positive. It is positive, and that you will hear of some stories regarding unfavorable experiences or responses to exercise, but they are few and far between. There is an inherent risk with exercise in general, but we know that certain steps can be taken to reduce that risk. So as I mentioned before, exercise does have a positive effect in patients with many different chronic and complex diseases, especially with neuromuscular disorders. And some of those may include myotrophic lateral sclerosis, Charcot-Marie-Tooth disease, as well as Parkinson's disease. So I will be talking more about Parkinson's disease in today's presentation because MSA is known as a typical form of Parkinson's disease. Now, besides the benefits of exercise in terms of slowing progression of certain diseases, we know that exercise can help with the treatment of the symptoms of a disease, and especially when it comes to neuromuscular diseases. So the benefits from exercise relate to improvement in physical function, muscle performance, and that would include strength, power, and endurance of the muscles, as well as overall quality of life. Now, as I mentioned before, there were some concerns about exercise in terms of its safety. Now, that has been disproven in terms of any, I guess, large negative effects. So exercise is safe, but it should be provided by a suitably qualified professional. And that will ensure that the exercise selected are appropriate. It will also ensure that as you progress with the exercise, that or exercise program, it will be done in a safe manner. I'm now going to spend a moment just speaking about this vicious cycle of inactivity. Now, people with neuromuscular disorders generally have increased fatigue, and they alter their lifestyles because of that fatigue, and that leads towards increased sedentary behavior. Now, a history of sedentary behavior, as you probably would be well aware of, is not a good thing. It can lead towards even greater weakness of muscles, but also the shrinking or the loss of muscle mass known as atrophy. And this causes this vicious cycle of disuse and weakness. Over a period of time, chronic cardiovascular and muscle deconditioning increases the risk of cardiovascular health problems. So we have this vicious cycle, as you can see on the screen now. You lose muscle strength, muscle mass, and then there's increased inactivity. And because of this loss of muscle strength and mass, there's a bit more fatigue, more effort to do daily tasks, leads towards a deterioration in terms of the cardiovascular function, and then greater increases in fatigue, and then that leads towards greater inactivity, and that's the cycle that we basically want to break. If we continue on with that cycle, you've got the negative effects of the symptoms of, let's say, MSA in combination with detrimental changes of an inactive lifestyle. So that compounding effect is not a good thing, and we want to minimize any type of inactivity as possible. Now we get to the part where we're looking at the rationale for exercise in neuromuscular disorders, and the focus primarily will be on people with multiple system atrophy, MSA. Now, gait impairment and reduced mobility represents the pivotal symptom of Parkinson variant of MSA, so known as MSAP. Now, Parkinsonism has been identified as the initial feature in just less than 50% of patients with MSA, but eventually over 80% of patients with MSA will develop some form of Parkinsonism or Parkinsonian features. When the cerebellar dysfunction is more prominent, we know that is referred to as MSAC, and there's an autonomic dysfunction. Primarily orthostatic hypotension is present in around 75% of these patients. So that is one thing that we will need to address when it comes to exercise, because moving from one position to another can be unsafe at times, especially with changes with blood pressure, and we just need to take certain steps to reduce the risk of falls and just overall feelings of discomfort. Patients with MSA also exhibit muscle weakness with impaired muscle performance and loss of balance, and that's a major focus of a lot of the exercise when it comes to people with MSA. We want to try to, if possible, reduce some of this weakness and impaired muscle performance, improve balance, then that will lead towards a reduction in the risk of falls. Now, why is that important? Because there was a study that has shown that people with MSA compared to people with Parkinson's disease have a 10-fold increase or more frequent risk of falling. So it's like 20% compared to 2%. Patients with MSA usually respond poorly to pharmacological treatment, such as dopaminergic drugs. So with exercise, it can assist with controlling some of the symptoms associated with Parkinson's disease. Non-pharmacological strategies, as exercise is considered, is important with these symptoms. So it can mitigate these symptoms, as I had mentioned. And a lot of the recommendations based on exercise, they have been influenced by patients with Parkinson's disease. So I will be spending a little bit of time just discussing what current research tends to show in terms of how effective exercise is and how exercise can be useful for people with MSA. But just keep in mind that there's not a lot of research out there, and a lot of the recommendations tend to exist from studies that have been conducted in patients with Parkinson's disease. All right, so now we get to the part where we're looking at the effectiveness of, and safety as well, of exercise in people with multiple system atrophy. As I just mentioned, very little published literature on exercise interventions in people with MSA. Now, I conducted a search of an electronic database of research material known as PubMed, and from that search, there were 4 studies that were identified to date. So it's from the earliest record up to July 2023 that focused on exercise in patients with MSA. Now, a breakdown of these studies. There was one that looked at the use of Tai Chi, and that was a case report. One MSA patient, and also they compared that to a patient with Parkinson's disease. There was one study using functional training. So functional training involves a combination of different exercises focused on improving the strength, the mobility, the flexibility of the person, as well as posture and balance. In that study, they compared a large group of people with MSA. So there were 10 people with MSA, and they also compared it to a control group, which was a group of people with Parkinson's disease. And finally, there were 2 studies using resistance training, and these studies were case reports, so 1 MSA patient in each study. So I'm just going to go through these studies just to give you an overall view of how they were conducted and what the interventions involved, and then finally the results of these studies so that you can kind of have an idea of the potential of these different exercise strategies for someone with multiple system atrophy. So Wengler examined the effectiveness of Tai Chi in a patient with Parkinson's disease and also with a person with MSA. And intervention involved participants performing 3 to 5 sessions per week. So that was of a 90 minutes duration per session of Tai Chi over 2 months. So it was an 8-week intervention there. The Hone and Ya stage 2.5, the Hone and Ya classification system was used, and that's a system that I'll share with you in a moment, based on symptoms of basically Parkinson's disease. And the person with MSA was rated at a stage 2.5, and that meant they were ambulatory, or able to perform, I guess, walking and that type of activity there. Now, the results of this study show that the confidence activities related to balance improved for both participants. So through engaging in this type of exercise session, both participants or patients, they felt a lot more confident in activities related to movements, related to balance, and obviously that was a positive part. Now, performance in terms of functional and balance tasks, so a physical task, it only improved with the patient with Parkinson's disease, so not with the patient with MSA. So we have to kind of then question how effective this form of exercise was for that person with MSA. It was beneficial for improving physical performance in terms of the function and balance tests for the person with Parkinson's disease, but not for the person with MSA. Potentially the exercise or the exercise intervention Tai Chi was not strenuous enough or was not targeted towards the needs of the person with MSA, and I will touch on that when we get further through this presentation. Next study involved functional training. So this study examined the effectiveness of a functional intervention in 10 patients with multiple system atrophy with the Parkinsonism type of MSA compared to 10 patients with Parkinson's disease. Now, the participants with MSA, they were approximately 20 years younger than those with Parkinson's disease. They also had a worse quality of life score and functional performance. So there was quite a difference there in terms of their age and just overall function and quality of life there. But all participants had a similar rating on that Hone and Ya stage, which was equal or less than 3. And as I mentioned, it's a scale used for comparing functional disability associated with Parkinson's disease, and this is the scale. You can see stage 1 all up to stage 5, and for the Tai Chi study, stage 2.5 there, so mild bilateral disease with recovery under the pool test. So you can see the person is still able to stand, but obviously posture is affected there. Stage 3, we can see that there's mild to moderate disease progression, but the person is physically independent. When we get towards the stage 4 and 5, we can see that there's more disability, so challenged to be able to stand or walk unassisted, to stage 5 where the person is wheelchair bound or bedridden unless there's assistance. So the majority of the studies with people with MSA, they're around the 2.5 up to around the 4. You'll see that with some of the latter studies that I will show you in a moment. So the exercise intervention here with the functional training, it was a 5-day inpatient physiotherapy program followed by 5 weeks of unsupervised home-based exercise. And the program here is listed below. You can see that there's various types of exercises, catering for the different components here. So strength and transfers, posture mobility, balance and walking, with all the different types of exercise underneath. Now, across the intervention for the above exercises, when the participants felt like they were not challenged enough, it seemed a bit easy, then there were variations made, such as increasing the number of repetitions, number of sets, body position, so just things to make it a little bit more challenging. And here are some of the exercises that the participants were involved in or engaged in. So rising from a chair, so sitting down, standing up, rotating the trunk, as you know, with people with Parkinson's disease and MSA, the trunk there can be quite stiff. So we want to make sure that we can help to reduce a lot of that tension, which will enable a greater amount of movement with activities of daily living, makes things a lot easier. Stair climbing, really good exercise there for function as well as balance. Walking on a line there, and also encouraging larger movements, because over time with MSAP, with the progression of those symptoms, we see smaller movements, and we want to encourage as much as possible big movements with all our exercises there. So the results of this study, there were similar changes observed for people with MSA and also Parkinson's disease, and in particular walking speed improved by about 15% over that roughly 6-week intervention there with people with MSA. Balance and performance in the timed up and go test. So this is a functional test or functional test. They did not change. Quality of life and clinical symptoms also did not change. So overall, the exercise program was considered feasible. It was safe, effective for improving walking ability in patients with MSA. Unfortunately, this intervention was not very effective for improving quality of life and the clinical symptoms for people with MSA or Parkinson's disease. So again, similar to the study with Tai Chi, there were some positive findings, but essentially the exercise intervention didn't go to the heart of the symptoms that are of main concern for people with MSA, such as helping with like balance and function, while it was important that we do note that in walking ability did improve, or the speed. Okay, so now we have the resistance training studies. These are the ones that I get quite excited about, because I am passionate about resistance training. So here, the first study is by Silva Batista, and with this study, there was a 79-year-old male with MSA, the Hone and Yar stage. He was towards the higher end, so stage 4, so definitely more disabled there. There was no change in medication throughout the study, and the intervention this time a lot longer than those 6-week or 8-week interventions we saw earlier. This was a 24-week resistance training program with 2 sessions per week, total of 48 sessions, 40 to 50 minutes per session. So this is the protocol here. As the months continued, what you see with the table here with describing the exercise intervention, we see the number of sets. So they're the group of repetitions, they would increase. So there was a greater amount of exercise performed. And the exercises that were performed, this is in the photo here, a leg press. So using the leg muscles and trying to push against a platform and moving their body. Okay, and that trains the leg muscles or the extensors, so the muscles around the legs as well as the hips. And there was also some other exercises such as the squat and also plantar flexion, like standing on your tippy toes. And what was included in this intervention was the use of these devices such as this Bosu. It's like a half kind of a Swiss ball or a fit ball, and that was to create some instability, and also a balanced disc that the person sat on, again, to create some instability. So as the participant was trying to lift as much as they can, or trying to perform the training involving the leg muscles, there was these devices that were placed on the feet and also the back, depending on the exercise, to help just promote a bit of instability. So the findings, muscle size, so this is known as cross-sectional area of the muscle, that increased by about 7%. You can see the increase by 6%, 6.8%. 1RM, which is a measure of strength, so how much someone can lift with 1 repetition, that increased by about 40% for the leg press. And then we have a whole list of different Other tests related to function. This timed up and go test, this time stands test. So that's the number of repetitions from a seated position, so standing up and down. Balance test, and then there's this UPDRS, which is a Parkinson's disease rating scale, and one based on function, one based on symptoms. That improved, and then also quality of life based on the Parkinson's disease questionnaire. All the symptoms there decreased. So positive changes, really large improvements there. Now, keeping in mind, this is just one participant, but we see some very impressive results here. Resistance training in this participant basically was an ideal exercise intervention for improvement in their condition. Now, another resistance training intervention study. This was by Wedge, and this was now in a female with a 68-year-old female with, again, a Hone and Yahr stage 4 symptom severity there. There was change in medication towards the end of the study, and resistance training was added to an existing program of balance and flexibility training, and that's shown on the next slide. Now, a big aim of the study was for the patient to be able to live at home and care for herself and a disabled spouse. So this is just the components of the existing program she was following. So it's all based on kind of like movement, like walking kind of movements and stretching and balance. So then she was involved in an intervention, 22 weeks, resistance training, 2 sessions a week, total of 44 sessions, 60 minutes per session. And you will see these are all the different exercises here, focusing on the legs. We've got the hips, so moving the hip or the leg out. We have a knee flexion, knee extension, and we have the hip adduction here. So each of the exercises were performed with 10 repetitions for 3 sets, or 3 times they would perform these, or she would perform these exercises. And the resistance was increased when the participant was able to lift the load with good technique for around 12 to 15 repetitions. And that's when it was time to change the exercise, or not change the exercise, but increase the load of the exercise to ensure that it was a bit more challenging. So the results, you can see some very impressive improvements here. Timed up and go, which is a function test, increased by about 30%. Mobility increased by about 9%. A reach test improved by 50%. And importantly, a single leg stance. So she was unable to do it at the beginning. She can now stand on one limb for 10 seconds. Impressive improvement. Excellent there. So we can see that from these results, there was improvement in walking pattern, festinating gait. So this is where gait tends to be kind of shuffled, and the posture is not ideal. Person's hunched over. So that was rarely evident after the intervention. There was improved transfer technique and more upright posture, as I just mentioned. Decreased frequency in falls, very important point there. And lastly, she remained at home with her spouse and continued to participate in community activities. Really important. She achieved her goal. So the 22-week intervention was highly effective for achieving her goal and improving upon the symptoms that she was experiencing from MSA. So in conclusion, effectiveness, resistance training combined with balance and stability training does appear to be more effective than just looking at gait training or balance training or instability training alone. And that's for all of these different areas here: gait, impairment, reduced mobility, muscle weakness, muscle atrophy, so the loss of muscle size, impaired muscle performance, reduced quality of life and severity of symptoms. And this is also found in another study by a researcher who compared combined effective resistance training and balance training compared to balance training alone. So when it's combined, it tends to be quite effective. Just lastly, a couple of points. There's no research currently on aerobic exercise in people with MSA, but it is important that mitochondrial dysfunction, so a cell within the muscle that's important with energy production, that tends to be affected negatively in people with neurodegenerative conditions such as Parkinson's disease and also MSA. And exercise is an important factor that assists with improving the function of the number of mitochondria. Swimming is also considered to be an ideal exercise for people with MSA due to the hydrostatic pressure of the water, and it can counteract hypotension for people with MSA-C. However, it is important to just mention that caution is warranted with the studies that I've presented because of the limited number of studies. There was only 4, and also the number of participants was quite small as well. So there was those 3 studies that only had 1 participant with MSA. So points to assist with exercise safety in MSA. You want to avoid exercise in warm environmental conditions. That will help with just regulating blood pressure and cardiovascular responses. Avoid the Valsalva maneuvers. That's where you're holding your breath, such as when trying to do a resistance exercise, lifting a weight. We want to avoid that. So preventing large excursions with blood pressure. Monitor signs, vital signs, heart rate, blood pressure. Monitor fatigue before and after sessions. Supervised sessions would be ideal. Assistance with moving from one exercise to another for the safety of the exercise program. Exercises should be individualized. So that is kind of tied into the next point where seeing an exercise professional would be ideal to ensure that the exercise program is safe and effective. And that might be someone such as an exercise physiologist. So some final points. The aim of exercise for people with MSA is to relieve symptoms and to assist performance in activities of daily living. Now, through improving the sensitivity and specificity of diagnostic criteria, and most importantly, identifying early biomarkers of MSA is likely to show that exercise interventions will be more effective because the people that will be then provided with exercise will be in a more functional status, and therefore they would be able to do exercises that may not be possible for people that have already progressed to, I guess, stages where they are not as able. So that's something to consider. But over the whole spectrum of, I guess, the progression of MSA, exercise has been shown, as you can see through the results that are presented today, effective with reducing the severity of symptoms and overall increasing quality of life and reducing the risk of some nasty events such as falls. All right, thank you for watching this presentation.